Okay, everybody. So this is the series entitled Moving Away from Family Separation, Cross-System Strategies to Support Young Children and Families at Risk of Child Welfare Involvement. This is the third webinar in the series, and it is entitled From Mandated Reporting to Mandated Supporting, What Will It Take? I am your moderator. I'm Cynthia Tate, and I'm with the Build Initiative. We can move the slide. Okay, so for the entire series, here are the objectives. First, we're trying to raise awareness about young children and their families who are involved in or at risk for involvement with the child welfare system. We're wanting to educate participants about the racial disparities in family separation from child welfare involvement. We want to promote opportunities and upstream strategies for prevention for families and communities, and to provide examples of cross-systems collaboration on behalf of our youngest children. Slide. So for this particular webinar, our objectives are to understand the data on mandated reporting and its impact on racial disparities in child welfare system involvement, to learn about mandated supporting initiative in California, also called MSI, to get a national perspective on why this matters and the importance of alternative pathways to assessing risk. And we want to hear about the role of the Child Care Resource Center in Los Angeles as a pilot for MSI. So I want to introduce to you our panelists. First, Dr. Tamara Hunter, the Interim Executive Director of the Los Angeles County Prevention and Promotion Systems Governing Committee. Dr. Hunter, you want to raise your hand there? All righty, that's Dr. Hunter. I want to introduce next Dr. Susan Savage, Research Director for the Child Care Resource Center, also in California. And Cynthia Verdugo, Supervisor, Home Visiting Program, Child Care Resource Center. Susan and Cynthia, would you just wave your hands at everybody? All right, thank you. I want to stop here before I introduce Darnisha, because these three presenters are in Los Angeles, and they are living through and in the devastation the rest of us are looking at on TV. And so I want to give a particular thank you to them for being here. We can only imagine how it feels to be there going through what everybody is going through, and knowing that you women are supporting families even at this time, and maybe especially at this time. We want to hold our hearts open for all the folks there in Los Angeles who are experiencing this catastrophe. And we send everybody wishes for peace and hope. And again, thank you. Now I want to introduce to you Darnisha Allen, my good friend and training technical assistance integration manager at the Safe Babies program at 0 to 3. And Itzel, can we see you?
Yes, absolutely. I can go
All
ahead
right. This is
and
our Spanish interpreter, everybody. She's going to tell you how this interpretation service is going to work. Okay, Itzel, thank you.
Perfect. Thank you. Just a quick announcement for interpretation services. We will be providing simultaneous interpretation for this webinar in both English and in Spanish. So I will be sharing some instructions in Spanish first, then in English. Hola, muy buenos días a todos. Mi nombre o tardes. Mi nombre es Itzel y estoy aquí de parte de la cooperativa de Community Language. Estoy aquí para proveer servicios de interpretación simultánea de inglés a español y español a inglés. Así que en unos momentos vamos a encender la interpretación simultánea y ya que la enciendamos van a poder ver un icono terraqueal en la parte inferior de su pantalla. Cuando le hagan clic a este icono van a poder elegir entre el canal de español y el canal de inglés o el canal de inglés. Y es importante para que cada persona que no sea bilingüe elija su idioma, inglés o español, para que cuando estén hablando en un idioma al otro, usted pueda seguir escuchando en el idioma que eligió originalmente. Y solo un recordatorio que estoy aquí porque los organizadores de este evento se han comprometido con la justicia del lenguaje. Así que queremos asegurarnos de que cada persona en esta sesión pueda escuchar y ser escuchados en el idioma de su corazón. Y si en algún momento tienen alguna pregunta, alguna duda, por favor déjenos saber en el chat o con su micrófono y estamos felices de ayudarles. Y de nuevo, en unos momentos aún no encendemos la interpretación simultánea, pero solo como les había mencionado, elijan entre el canal de español o el canal de inglés si es que no es bilingüe. Gracias. All right, so in a few moments, we will turn on the simultaneous interpretation, and once we do, you will see a globe icon at the bottom of your screen. So once you click on this icon, you will have the option of choosing either the English or the Spanish channel, and this is the language in which you would like to participate and listen during the meeting or during the webinar. And it's important for every person who is not bilingual to choose a language just so that you always continue listening in the language that you prefer. And just a reminder that I'm here because the organizers of this event have made a commitment to language justice. And so we want to ensure that every person in this webinar is able to listen and be heard in the language of their hearts. So once we turn on the globe icon, please choose English or Spanish. And if you have any questions at any moment, please let us know in the chat and we will be happy to help you. And we are good to start the interpretation.
Thank you, Itzel. Okay, let's move our slide. I think we can get going. So I have introduced our presenters to you, and so now the question is, who are you? And so we want you to know that over 1,000 of you have registered for this particular webinar. That's a big number. And no, we're not nervous, but we are very happy that you're here. 49 states in DC are represented, the Virgin Islands and Puerto Rico. You are from state agencies, including early care and education, economic security, children and families, health, public health, mental health, maternal health, public instruction. You are with national, regional, state, and community organizations. You are with formal and family child care centers, universities, and family foundations. Quite a group. Thank you so much, all of you, for being with us. Now, who are you in terms of your positions? I love this word salad here, or what is it? Word cloud. That's what it is. A word cloud. And you can see from this, all kinds of people are interested in this topic. It affects so many people. So many of us are mandated reporters. So many of us have seen mandated reporting happen and have had concerns about it and have been looking for what is an alternative. And so again, we welcome all of you, and we're going to talk about all of those things. So this is a list of things that people want to learn more about. I'm not going to read this whole list to you, but as you can tell, people have a lot of curiosity about young children and their families and the systems that serve them. And so we are going to continue at Bill to do our best to bring information and knowledge to everyone who is interested in participating with us to share this information and to bring it back to wherever it is that you sit, in whichever system, in whichever state, so that you can figure out what you can do about it. All right, next. So how to participate in the webinar. Introduce yourself in the chat, which we've got that going, everybody. Thank you so much. If you have questions, we welcome your questions. Put the questions in the chat or the Q&A, and members of our team will be watching those, and we will be putting them together for the Q&A section of our webinar today. And then there's going to be a survey at the end. At Build, we are really serious about hearing from people how we did and whether we met your expectations, whether or not we informed you in the ways that we hope to. And so we really want to encourage you to take the survey. It will come to you right at the end after the webinar closes. Okay, team, am I supposed to do anything else just yet? I'm good? Okay, all right, great. Okay, so the next slide should be for Dr. Hunter. And there we go. Dr. Hunter, I'm turning it over to you.
Thank you so much, and greetings to everyone in attendance. It's really great to be in this space with you to talk about some really important work that's underway in LA County. In May of 2023, our county's Board of Supervisors took an incredibly bold and courageous step forward in directing the reform of mandated reporting of suspected child abuse and neglect in LA County. I like to describe mandated reporting as the point in which society's isms, racism, classism, paternalism formally intersect with the child welfare system, and mandated reporting is the gateway into that system. The work that LA County is carrying out is a reform effort because we believe that it is important to have a process in place that allows professionals who come into contact with vulnerable children who may be unsafe to alert Child Protective Services to these concerns as quickly and as easily as possible. So we do believe that there's a need for such a mechanism. However, our work is also grounded in the fact that the child welfare system is a source of profound harm for far too many children and families, and mandated reporting in its current state is deeply flawed, it is deeply misguided, and it is extremely harmful. And so we hold both of these truths as we carry out our work. Critical to the work underway in LA County is narrative change. And one of the most important narratives that we seek to disrupt is the notion that what we are currently doing, that mandated reporting, is somehow a necessary evil to keep children safe. That is a fallacy. And there are many other fallacies about this policy that I will lift up in this presentation. And I'll move very quickly through my deck because I have a lot to say, but not much time. I do want to say that the content that will be presented on the next slides is not intended to shame or to blame any particular sector or type of mandated reporter. However, it is intended to be an indictment on a system that we all have a collective responsibility to improve. So many people are surprised to learn that most reports of suspected child abuse and neglect that are made by mandated reporters are not substantiated. And substantiated means that after a Child Protective Services agency has gone out, conducted an investigation, that they determined that the abuse or neglect did occur. Most of the reports that mandated reporters make are not substantiated. These data that I will share with you are from LA County. However, they are representative of what we see across the nation. So in LA County, as is the case across the nation, mandated reporters make the most reports to our child protection hotline. They make 89.5% of all reports to our hotline. And general neglect is by far the most common maltreatment allegation that is reported to the hotline. General neglect, I like to call it a black box. It's a very broad and subjective category. It is often conflated with poverty, and poverty can also be a risk factor for general neglect. These bars that you now see represent mandated reporting rates by mandated reporter type. So you see here in LA County that law enforcement and educators make the most of our reports to the Child Protection Hotline. And then that's followed by mental health professionals, child welfare staff, medical professionals, and then there's a category that's other professionals that includes everyone else who's a mandated reporter but doesn't fall into one of those large groups. Childcare, people who identify as childcare providers or daycare professionals make a little half of a percent, 0.5% of reports to our hotline. We believe that folks in the early care and education sector report as educators when they report to the Child Protection Hotline, that they self-identify as educators. So they really fall into this category that makes 24% of all reports to our hotline. These bars that you now see represent the percentage of these reports that turn out to be substantiated after CPS has gone out and conducted an investigation. So you see that just a fraction of these reports turn out to be actual child abuse and neglect after an investigation has taken place. And I do want to draw your attention to educators because they have the lowest percentage of substantiated reports made to the hotline. And the variance that you see, or the gap that you see between the reports that are made and the reports that turn out to be abuse or neglect after an investigation, can be attributed to a number of factors. They include bias, fear, fear of personal and organizational liability, bias based on race, bias based on class, and also conditioning. The child welfare field, and I am a member, I am from this sector, for decades, we have conditioned mandated reporters to knowingly over-report to the child welfare system and to let us sort it out on the back end. And we've done so as though there were no consequences for that. And that really couldn't be further from the truth. There are significant consequences for over-reporting. Many mandated reporters tend to believe that if they make a report to the hotline, such as those cover yourself reports that we all have made, that if we make those reports just to be safe or just to cover ourselves, if CPS goes out and conducts an investigation, and if there's no abuse or neglect happening, everyone moves on with their lives, no harm, no foul. Everyone moves on unscathed. And that is untrue. There are significant consequences for over-reporting to the child welfare system. Involvement with the child welfare system in this country is without a doubt a manifestation of the criminalization of poverty. This is because the families who come into contact with the system are more visible because they rely on public systems to have their needs met, and they are more vulnerable because in many cases they cannot afford justice. Our strongest evidence for the intersection between class and reporting is found in healthcare settings, where we see variance in reports based on insurance type, which is a proxy for a family's socioeconomic status. Involvement with the child welfare system is also terrifying. I had one parent share with me that it is terrifying, and it is a type of trauma that never goes away. For Black and Indigenous families in particular, involvement with the child welfare system takes us back to a time in the not too distant past in which family separation was a weaponized tool of oppression. And now that we know that trauma is epigenetic, that means that we carry it in our DNA and we pass it on to our descendants. So now that we know that that happens, just the very threat of the child welfare system becoming involved in a family's life, the potential for having a family separated can trigger that that unconscious trauma, and disrupt a family in ways that they may not even be aware of. And the fact of the matter is that if a family is truly experiencing hardship, is truly going through an incredibly stressful time, no one says, thank God, CPS is knocking at the door, everything's going to be okay. That knock on the door is compounding. It compounds the stress that family is experiencing, and it can contribute to a domino effect that can destabilize that family and make children less safe. And children being less safe is a common theme in this current approach to mandated reporting. Another critically important way that what we're currently doing actually makes children unsafe is the way in which it disrupts a family's trust in the organizations that they should be able to turn to in times of need, such as their schools, such as their community mental health clinic or their child care center. And when families are afraid to ask for help when they're in need, children are less safe. When families go underground because they're struggling, children are unsafe. For every family that is reported to the child welfare system, even if that investigation turns out to be not substantiated, that is one strike on that family's record. And over time, even if all of those strikes are for unsubstantiated investigations, it will have a negative impact on that family. And the final consequence of over-reporting that I'll lift up is the way in which over-reporting families who can have their needs met safely in community takes away resources from children who may truly be unsafe. And this is another way that mandated reporting in its current iteration contributes to creating safety risks for children. The director of our CPS agency in LA County is a champion for reform, and he once said that there is so much smoke with mandated reporters calling and making reports about things that should not be reported. There's so much smoke that my people cannot see the fire. And we found that to be an incredibly profound statement. Mandated reporting is a driving factor of the racial disproportionality that is pervasive in the child welfare system. These data again are from LA County. And what this chart tells us is that Black children are reported to our child protection hotline at staggeringly disproportionate rates. So this chart overviews reporting rates for children under age 5 in LA County. And what it shows is that in 2022, for every 1,000 children in LA County who were under age 5, who were age 5 and under, 111 Black children were reported to our child protection hotline. And the second highest group is Latino children age 5 and under, and 43 children per 1,000 were reported. So I invite you to just pause for a beat and take a beat and look at this visual and let this staggering disproportionality sink in. There was a California study that found that 1/2 of all Black children would be investigated by CPS before their 18th birthday. One half of all Black children in the study cohort were reported and investigated by CPS before they turned 18. That's in comparison to less than a quarter of white children. Again, really staggering rates of disproportionality at the front end of our system. And this chart that you see walks us through the continuum of child welfare services for a Black child in LA County. In LA County, Black children are 7.7% of our general population, yet they are the subject of 19% of all reports that are made to our child protection hotline. They are the subject of 19% of all investigations that are conducted by our CPS agency. And on any given day in LA County, they are 27% of our foster care population. They are 38% of all children who go on to age out of the child welfare system, out of the foster care system, and are more likely to age out into homelessness, to age out into the criminal justice system, or to age out and become involved with the system as parents and have their own children potentially removed. And all of this begins with a report to a child protection hotline that was more than likely made by a mandated reporter. Many people are also surprised to learn that the current model of mandated reporting is not evidence-based. It has not been proven to prevent child abuse and neglect. In fact, as I previously mentioned, the current model chips away at those protective factors that we know are so critically important to keeping children safe. And this current model of mandated reporting, it really fails at that. Mandated reporting in its current iteration is reactive by design, right? Mandated reporters have been conditioned to believe that they have a binary choice of reporting or not reporting abuse or neglect that they suspect has already occurred. And in being this way, and in doing so, and in this design, this current model misses critically important opportunities to actually prevent child abuse and neglect upstream by providing resources to families who are in need. Mandated reporters also make reports to child protection hotlines when they don't suspect abuse or neglect, but are trying to get help for families who are in need. And they do this without fully realizing just what they may be bringing to bear on these families. We surveyed more than 2,000 mandated reporters in LA County, And of those who admitted that they had made reports to CPS when they did not suspect abuse or neglect, 65% of them indicated that they believe that making a report to the Child Protection Hotline is the best way to get help for families in need. Mandated reporters need a third option. And that third option to help families who are in need but who don't need CPS has to be as easy as it is to pick up the phone and make a report to the child welfare system. We have given people, just based on where they happen to work, this tremendously consequential responsibility that is so important in the lives of so many people, and we have utterly failed to prepare them for it. Many mandated reporters feel, and they are, in fact, ill-equipped to make sound reporting decisions. Studies have found that our failure to prepare mandated reporters results in both over-reporting of families who don't need CPS, and we talk about this often, but it also results in under-reporting of children who may not be safe, and we don't talk about that nearly enough. Training is by no means the panacea to everything that's wrong with mandated reporting. It's not the answer to fixing it, but it is critically important, and it is the primary vehicle that we've used to condition folks to interact with families in this way and to over-report. We conducted a review of mandated reporter training curricula in LA County, and we found that it fails to prepare them to make accurate decisions about when to report and when not to report. We also found that in most large organizations like school districts, mandated reporter training and policy is developed by their insurance carriers. And that explains why it is developed through a lens of organizational risk management rather than being child and family centered. We also know that multiple factors influence reporting decisions, and we have failed to take action to counter them. I've mentioned bias based on race, based on class, paternalism, a desire to sort of regulate or control some families are certainly factors that contribute to reporting decisions, but there are also other factors that we haven't talked about nearly enough, such as the mandated reporter's own experience with abuse or neglect and how that may impact reporting decisions. Fear, conditioning, and studies have found that even factors as frivolous as the time of day influences the life-altering decision to report. And we've not taken action to buffer against this and to protect families who are on the other end of those reports. And perhaps the most important and most compelling reason to reform mandated reporting is because we have created a system that pits the best interest of mandated reporters and their organizations against the best interests of the families that we serve. So I hope that by now you're asking yourself, what can I do about this? How can I be a part of the solution? And we have an answer for that. Although individual factors like bias, fear, confusion about what to report, when to report, do contribute to some of the problems with mandated reporting, all that is wrong with this failed policy cannot be placed at the feet of individual mandated reporters without taking into account the organizational and the systems level factors that shape those individual level reporting behaviors. And so in LA County, we believe that transformation has to occur at 3 levels. It has to occur with individual mandated reporters, with the organizations that employ them, and at the systems level. And the great news about this is that we can all be a part of the solution. We can all effectuate transformation regardless of where we are situated and what our locus of control is, be it through the personal decisions that we make as mandated reporters, or the ways that we lead the programs or organizations that we run, or through advocacy at the systems level. So the initiative to reform mandated reporting in LA County is the Mandated Supporting Initiative. And we believe that reform has to happen through improving the training and decision support that mandated reporters receive, by building pathways to community-based resources that are going to make it really easy for mandated reporters to connect families in need to help, by rectifying flawed law and organizational policy, and most importantly, by changing some of the narratives that hold this failed policy in place. And as I stated at the beginning, one of the most important narratives that we have to disrupt is the belief that somehow what we're doing and the way we're doing it and the way we're harming families is a necessary evil to keep children safe. There is a better way. Thank you. I will return the floor to our moderator.
Dr. Hunter, my goodness. Very powerful presentation. Thank you so very much. There's been so much activity in the chat. People are really engaged and have a lot of questions, and so we're going to have an opportunity for people to get some responses to their questions very shortly. But thank you again so much. I'm sure there are also not only questions but a lot of feelings and reactions, and there should be. All right, well, thank you. We're going to move now to Dr. Susan Savage and Cynthia Verdugo from the Child Care Resource Center there in California. Susan.
Thank you so much. I appreciate this opportunity to share what we've been doing in collaboration with Dr. Hunter. I'm Dr. Susan Savage, Director of Research at the Child Care Resource Center, and with me is Cynthia Verdugo, who will be speaking in a few minutes, and she is our supervisor of our home visitation program. Next slide, please. After a really successful grassroots effort in supporting parents who work and go to school, in finding childcare that really suits their needs, because every parent has a different need, we were, as Child Care Resource Center, incorporated in 1976. And our mission and our vision drives all of the work that we do. Our mission is to cultivate child, family, and community well-being. And our vision is to see healthy and strong children and families in thriving communities. Now, we do our work through the efforts of over 1,300 staff. So we've grown quite a bit from the few staff we've had in 1976, and through our service area that is slightly over 22,000 square miles. As you can see, we also have an office up in Sacramento. And so it's not just our service area that we impact families. It's through advocacy, through Sacramento. And if we were to actually show our influence across California, there would be lots of arrows and connections and building blocks throughout the state of California, because we've also really made sure that we connect through other organizations across the whole state of California and influence the work in that manner. Next slide, please. I'm not going to read all these numbers to you because you can do that on your own. But what I want to really showcase here is CCRC's whole child, whole family perspective, where we will ensure that we provide services for whatever the needs are in the community. We find out the needs, we pilot it, we get funding, we try to take that to scale. And so these are just a few of the programs that we offer at CCRC to really address all of the needs that we have in our communities. One of the elements here I'd like to hone in on is the 40,000 referrals that we provide to our community. And these are referrals for housing, income supports, mental health, legal services, whatever it is that our families and communities need, we will refer out to. And that is the key part of the mandated supporter initiative. If we're going to move from mandated reporting to mandated supporting, we really need to sharpen our skills, our connections, our partnerships in communities to be able to know who to refer to at a moment's notice. We also have a basic needs center where we gather donations so that we can provide critical resources, those basic need items to our communities. And we're doing that right now with the fires. As you can only imagine, when there's a natural disaster such as these fires, there's going to be increased need for supports to ensure that families are not more stressed, more taxed than they are in a general situation. Now, a lot of this is really ensuring prevention so that families don't become overly stressed, don't need to be known by the child welfare system. And being able to build up these systems is really a prevention lens. And one research study I want to bring to everyone's attention, and I can put the link in the chat, is a study by Chapin Hall in, I think it was March of 2024, where they talked about the fact that excessive reports to the child welfare system really inundates the caseworkers in that system so that they aren't necessarily able to provide the resources and referrals that they would want to do because of getting these unnecessary calls that you saw from Dr. Hunter. And I can put that link in the chat in a bit if folks are interested in that study. Next slide, please. So why would CCRC be chosen to pilot an initiative like the Mandated Supporter Initiative? Well, first off, our values, including racial justice. Whenever we see racial inequities in access to programs, services, policies, etc., in our own agency, at the state level, at the national level, we bring those to the forefront and work with our partners on how do we dismantle the systemic racial inequities. And that is part of the whole Mandated Supporter Initiative. For too many years, there's been over surveillance of Black, Brown, and Indigenous families, and that needs to stop. And it can transition into supporting instead of reporting. Another aspect of why CCRC is a great agency for piloting this initiative is our leadership. Dr. Mike Olnick, our CEO, really creates and fosters an environment for innovation and testing and serving in new ways our communities. When he was going to be attending a community meeting on prevention, he got pulled into another meeting that he needed to attend. And so our chief program officer, Jose Ramos, attended that prevention meeting. Being at the table is part of what we need to do to ensure that we are serving our communities. And so it was at this meeting that Jose Ramos found out about the Mandated Supporter Initiative and of course raised his hand immediately and said, let's do this. Let's pilot that at CCRC. We have programs that can do this. Leadership at the community level is another reason why CCRC was a valuable asset in piloting this program. Our true boss is the community. Our families, our child care providers, they tell us what to do because they know their needs way better than we do. And by listening to the community, we can then create these programs, pilot them, test them, and bring them to scale. Another asset of CCRC is my supervisor, Donna Sneringer, who is our Chief Strategy Officer, who oversees the research, communications, government relations, and our statewide initiatives. And what this allows for is through research and gathering the needs from our community, we can then begin to build pilots, test pilots, communicate that out to the broader public, government relations can take that information and advocate for it, whether it's funding, etc. And then with our statewide infrastructure, we can begin to take that to scale, which we have done in the past. Next slide, please. And I'd really like to introduce Cynthia Verdugo because she has the lived experience as our supervisor of our home visiting program, and she can begin to tell a little bit about what the initiative entails and some real life experiences that she's had through this program. Thank you, Cynthia.
Thank you, Susan. So these children here on this slide are why we do what we do. Next slide, please. Here's a look at what our agency was doing prior to being a part of the pilot program. Our Family Wellbeing Division really enforced mandated reporting. So we have a written procedure in place where we have specific instructions on what to do if we need to make a consultation call. I also have a field case where this was prior to the training. So last year in March, one of my home visitors enrolled a brand new client. And we do let clients know that, especially at that first visit, that just like teachers, doctors, pretty much anyone that works with children, we are mandated reporters. So at the second visit, the client had disclosed in conversation to the home visitor that she had left her 2-month-old baby alone in the home so that she could go get something to eat down the street. And there were also 2 other incidents at this same visit where the home visitor observed the client leaving the car running while in park and took the baby out of the car and placed the baby's car seat behind the car. And the home visitor actually had to step in and take the baby to a safer location so that the client could move her car. And the home visitor also had observed trash that was piling up in the home. So in our individual reflective, my home visitor shared with me that she felt very uneasy about the incidents, and she ended up making a consultation call. So I was on Zoom with her while she was making the call, and even the social worker, I recall that she even felt conflicted, but she said, you know, leaving the baby alone, that was pretty serious. So she did tell my team member to fill out the report. And the outcome of that was that a social worker did end up conducting an investigation, and the case was actually closed. But luckily, I am happy to report that the client is still in our program, and to this day, completely unrelated, but my home visitor ended up saving this client's life at another visit by calling 911 because the client had an underlying health condition. So needless to say, she's been through a lot with this client in just a short time. So a few months later after that, our home visiting department and our early care and learning department leadership were selected to be a part of the pilot program. Our leadership team did meet frequently with the mandated supporting initiative pilot design team leading up to the training that we completed on August 9th of last year. Next slide, please. So after completing the training, we have been actively making changes to implement mandated supporting. We are currently in the process of updating our policies and procedures to reflect the initiative, to reflect the language of the initiative as well. We are utilizing the general neglect decision tree when we are unsure on whether to report or not. And interestingly enough, My same team member utilized the decision tree just last week for that same client that I had mentioned earlier. There was another situation that came up where, again, my team member felt uneasy about something that the client had disclosed to her, and the client is currently pregnant. So I sat down with my team member and had her answer the questions on the decision tree very candidly with what information that she did have. And a lot of her responses were leaning toward not having to make that call. And she did end up feeling better about her decision. And I also spoke to my manager and I let her know what the outcome was and that she was not going to make the call. Instead, we are in the process of gathering resources for that client, such as mental health services and information about keeping healthy while pregnant. And since the training, we've also had other clients, for example, that are unhoused, where we did not call DCFS because our home visitors now have an understanding and are able to see the strengths of the parents. Our home visiting department and early care and learning department are implementing a suspected child abuse reporting tracker spreadsheet where we document any consultation calls that we have made, or if the client discloses to us within a visit that they have an open DCFS case and the outcome of each case. In our respective database systems that we use, our home visiting team uses Stronger Families database to record if we have made a call and the outcome of that. And the early care and learning department utilizes what is called Child Plus to document as well. We also have discussions during our individual reflectives with our team and group reflectives with our home visitors to support them in understanding what to do. Also in our team meetings, we have now set aside time to discuss mandated supporting resources for our home visitors, including providing them with the website supportingfamilies.lacounty.gov. And of course, any new staff that we do onboard, we are ensuring that they are trained and knowledgeable on mandated supporting, as well as providing any pertinent updates to our current home visitors. Next slide, please. So here is how we are supporting our families. We are very fortunate here at CCRC to have a wonderful communications team within our agency that essentially provides us with donations that they receive generally from all over. And because of that, we have been able to support our families with items such as baby formula, diapers, strollers, car seats, cribs, toddler beds, clothing, food, and much, much more to meet the needs of our families in program. We also utilize One Degree and Unite Us platforms when we are connecting our families to resources and following up with them. In our respective databases, we're actually required to follow up in the system anytime that we provide a referral or resource to a family. And lastly, we are really big on networking in the community to strengthen our resource tool belt. And so these are some of the committees and coalitions that we belong to, where we are actively attending, as well as inviting community stakeholders to our meetings to talk about what services that they offer. A lot of the times, our home visitors are attending these meetings as well. So they're able to have a direct point of contact person and a number for their family versus just a website with a general number. And even if our home visitors don't necessarily need the resource for a particular family, at least they have the information from the community networking partner for the family when and if they need a particular service. Next slide, please. So here is our contact information. I would like to add that we are so grateful to be a part of the pilot program. And the feedback from our home visitors after the training was that this change needed to happen. And it has essentially shifted our mindset to go from reporting to supporting. Thank you.
Thank you. Thank you both, Susan and Cynthia. Thank you so much. You're getting a lot of questions and interest in the decision tree and the training. And so I think people are interested in making, how do you go about making mandated supporting actually happen? So thank you for sharing that information. And again, we're going to have a panel discussion and a Q&A coming up. But right now we want to hear from Darnisha Allen.
Hi, it's a pleasure to share this space with you all. I'd like to share with you now that my contribution to this discussion is coming today from a national lens with Safe Babies, which is a program of 0 to 3, as we engage with communities and states in helping to mobilize those upstream approaches that would support child and family resiliency. And I'd like to lean in by sharing that no single entity that is represented on this call today could completely hold all areas of support for families in isolation. This is about our relationships and our coordinated energy, because professionals who are working with young children and families across various disciplines like childcare and home visiting, physical and behavioral health, child welfare, and others all need a broader understanding of child development and the roles that we each play in supporting a child's growth. We also need an understanding of how family challenges are found across the spectrum of the social determinants of health and how that has a direct impact on their learning and development. And we need a broader knowledge base about sustainable pathways to connect families with community services and resources to address their needs. I hear a lot of conversation about shifting to mandated supporting, but there's a necessary bridge for growth and skills that has to be a part of that expectation so that we're prepared to do that work. And while everyone doesn't necessarily need to be an expert, we do need a shared understanding of how we recognize needs and where we go for help. But this cannot be fully achieved without support from systems leaders. We need support in ensuring that resources can be accessed from different points of entry without withholding needs until they've reached a peak point. And we need cross-systems training opportunities that will equip professionals. And that investment in the workforce is inclusive of preparation and compensation. But to better conceptualize what we would stand to gain, as you've heard in the incredible work that's happened across LA County already, it's important to understand what's at stake, particularly as it relates to the 0 to 5 population, but this is universally important to everyone. Of that 7.2 million children in the United States that are referred to Child Protective Services, children under the age of 3 enter the child welfare system more than any other age group. In fact, every 7 minutes, there is a baby or a toddler removed from their family due to childhood adversity and placed in out-of-home care. And there's countless reasons to advocate for young children and their families, but perhaps some of the strongest ones are the fact that the rate and acceleration of brain development in the first 6 months is unmatched. The neurological connections are already happening at birth. And by 1 month of age, they've doubled. By 3 months of age, they've almost tripled. In fact, did you know that in the first 3 years of life, a child's brain will grow faster than it will at any other point in their entire lifespan? And this time is critical because healthy and positive child development emerges best in the context of nurturing, warm, and responsive early parent and caregiver and child relationships. When children are surrounded by a community with strong trust and social connectedness, they have the potential to thrive. But a baby or a toddler that is coming in contact with the child welfare system has been seen somewhere before. We all know it. They could have benefited from connections and services and supports. The child welfare system is often the last stop when a family experiences a system that might be working in a siloed way and uncoordinated. So, with the growing stressors faced by families of very young children, particularly those who are navigating economic insecurities and challenges when it comes to accessing quality care, it is time. It's time for us to ignite collective action across systems within the states and local communities to shift the way that we prioritize the basics. So I want to give you a little backdrop. For children in child welfare, the circumstances that typically are associated with a child's removal historically have been rooted in neglect at much higher rates than actual abuse. And according to the Children's Bureau, neglect is frequently defined as the failure of a parent or other persons with responsibilities for the child to provide needed food, clothing, shelter, medical care, or supervision to the degree that the child's health and safety and well-being are being threatened with harm. However, it's important to acknowledge and address the challenges that are faced by both the families and the workforce. These things that continue to manifest themselves in the tapestry that influences outcomes for young children and their families. In this country, 2 million infants and toddlers live in poverty. Poverty and low income are the most striking demographic factors for babies in the United States. Nearly 2 in 5, which is about 38.9% of the nation's infants and toddlers, live in a family earning less than 200% of the federal poverty level. That's essentially $55,000 a year for a family of 4, meaning they are lacking the basic financial resources to make ends meet. And given that 1 in 5 Black, Indigenous, and low-income families live in deep poverty in this country, they are more likely to be impacted by state policies that remove children after prenatal testing reveals substance exposure, regardless of the capacity to parent. In fact, recent studies have found that although Black families on average tend to be assessed at lower risk than white families, they are still 15% more likely to have a substantiated case of maltreatment. They're 20% more likely to have their case open, 77% more likely to have their children removed instead of starting in-home supportive service cases. And our nation's workforce continues to experience challenges as well. So the research and findings from the State of Baby's Yearbook that 0 to 3 puts out every year shows that childcare remains a significant struggle for families in the areas related to cost, availability, and quality. But this also presents challenges for the early childhood education workforce who are undercompensated and overstressed. As a country, we tend not to match our workforce value with the cost of living. But the stark reality is the majority of the individuals in the workforce who are engaging with families who have been identified as high risk, particularly in child welfare, early education, early intervention, and public health, are some of the lowest paying roles, where they are dangerously close to being on the receiving end of that very support. But so many of our professional practices perpetuate this necessity for tapping into a disconnected reality so that you can get through the work, even when you identify with the struggle. And in addition to all of this, maternal and infant health in the United States also remains a crisis. Our country has the highest maternal mortality rate of any developed nation. And if the nation is to make real progress in tackling perinatal health, it is critical that we begin this process by addressing the role of poverty and health inequities, particularly around housing, economic insecurities, safety, nutrition, and mental health. But early childhood and child welfare only hold part of this picture, as large systems that are trying to help families to overcome the challenges that they're facing. And that means that collaborations across systems is essential. Family policing does not begin with a child welfare investigation, as you heard Dr. Hunter say earlier. Policing is driven by bias. unmet needs, and social norms. It lives in healthcare, in classrooms, at Walmart, everywhere. Policing happens in community settings, which leads to the responsiveness that initiates a relationship with child welfare, and what we often see resulting in that family separation. But as you heard shared earlier, what we're unintentionally experiencing is the practice of criminalizing need and activating punitive solutions with the absence of resiliency building. And while mandated responsibilities are something that you must hold, the way we approach this could completely shift and yield a strength-based solution that will actually foster resiliency. There are opportunities across the spectrum of mandated supporting that you might identify with depending on where you are and your starting place. It may be acknowledging and identifying how the over surveillance of families shows up in your work environment. It may be establishing some shared practices and standards that will reflect reporting without the automatic intent of removal. So we recognize risk in circumstances, and you start with a preventative approach that will directly link action to that need rather than an investigation whenever possible. It may be exploring and elevating out a shift in the mindset in your workforce, which includes cultural differences, responding according to the actual level of need versus a universal protocol, and increasing your staff preparation with the tools and supports to respond to neglect in a way that will honor help-seeking behavior. It may be on a broader scale with collaborations with other entities, working to identify the mechanisms that you need to increase the effectiveness of the Families First Act or Title 4B in order to support families with access that prioritizes their basic needs versus crisis-driven engagement, and increasing our coordination across the early childhood governance structures as the true birth of early childhood systems building. But with a national push, efforts to change the definition of neglect to remove poverty and economic hardships and substance use disorders when they're independent risk to the risk of harm has really fallen into this shift around mandated reporting. Even more so, they actually specify that you have to instead connect people to support the resources. And 2024 has been a big year for state action around child welfare. About 38 states have passed almost 200 bills related to child welfare in some way. Some of those examples of state bills that are leading the way across the country are in Illinois, where they've created the Family Recovery Plans Implementation Task Force Act. It requires this coordinated public health and service integration response across agencies in the state with state health and their child welfare systems to address substance use treatment needs for infants who were born with prenatal substance use exposure, also treatment needs for their caregivers and their families, which requires the development, provision, and monitoring of a family recovery plan. It sits inside their Department of Human Services. They review models of recovery plans that have been successful in other states, and they make recommendations to replace punitive policies with notification policies to support healthcare professionals and reporting when they have positive toxicology screens for newborns. Also in Colorado, where they've created a bill that allows for a mandatory reporting task force that examines how well mandatory reporting laws actually keep children safe. And they require anyone that is a mandated reporter to have a specialized training to address those needs and decrease the disproportionate impact, particularly in under-resourced communities and communities of color and persons with disabilities. But there are some states that have taken actionable steps without state bills, like Arizona with their Office of Prevention. And they've created initiatives around mandated supporting reforms and new trainings to support mandated reporters in this work. In Philadelphia, they have the Family Support Through Primary Prevention to support their equity work. That also includes some strategies for modifying and supplementing mandated reporter trainings to shift that culture to looking at support rather than surveillance and streamlining the way families connect to concrete goods and supports. They've even created a referral line called Fairly Families Can for children 0 to 17 years of age. And in New York, they created a statewide help, empower, activate, reassure, and support, here's for short, line as a resource and referral line as a part of their strategies for reform, moving to mandated supporting versus reporting. And lastly, in Washington State, where they've developed a mandated reporter toolkit with specific call outs and advisement on when things need to be reported and when things need to be supported. But state laws around mandated reporting for suspected child abuse and neglect vary widely. But recent national discourse has called into question the harms of over-involvement with the child welfare system, particularly when we look at racial and income biases that often lead to families being investigated and separated. And so some states are actually looking at their mandatory reporting process so that they can minimize trauma, decrease removals, and address directly disproportionality. And in Illinois, with their new law, it replaces that punitive reporting policy for substance use exposed infants. And now they have a federally required captain notification report that is completely separate from a child abuse report that instead focuses on implementing those family recovery plans. It also keeps those children off the list of being named as abused and neglected when they are born with substances in their system. In Oregon, there's a new bill that commissions a study around mandated mandatory child abuse investigations to explore trauma-informed practices. And in Missouri, they've created grants for community-based programs to help get in front of that work, particularly for home visitors, to do sleep study education, child care planning, and other preventative services. Oklahoma expanded their children's specialty plan to involve children in family-centered cases who are not in foster care. And in Connecticut, their law does not consider prenatal exposure to be a crime. It actually requires those reporters to do a brief assessment to figure out if there is a separate report that needs to be done. And this notification system that they created has now diverted more than half of those substance-exposed infants away from child welfare and directly connected them with family and community services. And so the one resource I want to offer up to you in closing aligns with all of those state examples that I've just shared with you here. It's our Safe Babies Policy Framework that was created in support with our national parent leaders. This framework actually has 11 policy recommendations for states and communities that will aim to significantly improve systems to support families with young children and promote resilience and building community capacity to support these efforts, with the hope that this is a roadmap for you to share in your agencies, organizations, and partnerships with the state to develop and advance practice and some policy change. Thank you.
Thank you. I think that these hearts and claps that are coming up on the screen are indicative of how everybody is feeling about both your presentation and the other two as well. We're going to, can we bring everybody on the screen right now so we can have a little conversation together? There's been so much activity in the chat, right? So much, so many questions. People are really, really stimulated by what all of you have presented. And thank you so much. Let me assure everybody, because this keeps coming up, everybody will get the presentations, the recordings, and the resources that our presenters are making available to us. If you registered for this, which you did, if you're here, then you get them automatically. So please don't worry. But additionally, we have a collection on our website, and all of these will be available to you there as well. Okay, so let's have a little conversation. Boy, oh boy, where do we start here? I wanted to, it's hard to figure. But here's one issue that all three presentations did address, and that there are a lot of questions and there's a lot of concern about, and that is this business of decision making, to report or not to report. Am I required to? How do I know if I'm a mandated reporter? And the binary, as you pointed out, Tamara, this binary decision making is so insufficient for the complexity of what we're looking at. As you pointed out, Darnisha, really the question is risk assessment. So how are we expecting all the various people who have mandated reporter responsibilities to be able to assess risk for young children when they may have no background in doing that at all? And then there are questions about the tool that CCRC is using, the decision support tool. So I just want to open up this whole area for any conversation or comments that you all would have around this issue of decision making in this arena.
I definitely want to help make clear that this effort really is for the neglect side. It's not for other elements because, and I don't mean to gloss over this at all, but quite often the other types of abuse are, air quotes again, easier to detect. And when you connect with your supervisor and have some supports, those are not necessarily the ones at question because we do absolutely want to protect children from harm. That we're, I saw a few comments in the chat of how do you ensure you're still ensuring that you're protected. That's not what this is after. And Dr. Hunter, definitely I'm going to turn over to you. But it really is those areas where staff struggle of, okay, this family has come in or the child has come in day after day without a coat and it's 30 degrees outside. I'm going to make a call. Should I make a call? It's those types of instances where people need help making a decision, and the tools, whether it's the decision tree, what Cynthia talked about in terms of the supervisor support, wrapping around those staff so they're not alone. It's the general neglect, because you saw what Dr. Hunter was showing, that this many reports and this many substantiated for, especially for the general neglect. So that's enough of me talking. So Dr. Hunter, definitely I'd love to hear what you have to say.
Yeah, thank you so much, Susan. I just want to build on what you said. The MSI, LA County's reform effort, I think it's deeply rooted in reliance on the field of decision analysis or decision science, which is a field that policymakers, when it comes to mandated reporting, have largely disregarded, and along with the other much of the other extremely large body of research on mandated reporting. So I didn't spend a lot of time on this in my presentation, but training is insufficient to help mandated reporters make sound decisions for some of the reasons that I lifted up. So one of the cornerstone of our approach, or one of them, is the use of decision support tools, standardized decision support tools that will give mandated reporters the guidance and the support that they have said that they need. So we developed a training to operationalize a law in California that narrowed the definition of general neglect. So the first product that we developed is the decision tree that Susan shared in the chat, which focuses on general neglect. 4 simple questions for a mandated reporter to answer. It includes definitions and descriptions to try to take the guesswork out of, for example, extremely dirty. What is extremely dirty, right? That could mean something completely different to all of us in this virtual space. So we try to counter our cognitive biases. We try to counter subjectivity to the greatest extent possible. And we believe that the best way to do that is through the use of well-designed decision support tools. So we have this paper and pen decision tree that Susan shared. We are also developing a more sophisticated web-based decision tree that will include all types of maltreatment. And in large part, it is in response to mandated reporters saying to us, we've done extensive stakeholder engagement, we need help. We feel alone and as though we're out on a limb when it comes to this. And the last thing I'll say about decisions is that very few professions expect consequential decisions, right? And the decision to report or not report is extremely consequential. Very few professions expect consequential decisions to be made in isolation. but we expect that when it comes to mandated reporting, and we're trying to remedy that through our work in LA County.
Thank you for that. Yes, absolutely. It's just, um, as you said, there isn't any other arena in which this kind of the seriousness of the consequences of this kind of decision are equivalent. It's just very different. This business of surveillance and criminalizing families for being poor and other things is clearly driving this. Darnisha, I'm wondering what your thoughts are right now.
I would just add a little bit to that. Something Dr. Hunter said just really triggered me a little bit. It's a rare day as a mandated reporter that you didn't know whoever you were reporting. Even though I spoke of it happened in the community, it often happens more likely when you have access to, on some level, even briefly, that child or a family. So there's an opportunity in that space for a relational connection. There's some psychological safety that's at stake there. I think as a professional, to know that you have the opportunity to intervene with low hanging fruit. What are some of the things that you could assess and process? Someone put in the chat about children with sensory issues and codes, and I think that's a very relevant point. You know your audience. And so, how can you move differently without feeling obligated to reactively report? But I don't think, as Susan shared earlier, it's not about not reporting. It's about reporting so that it will trigger something different. I'm not reporting so that this moves into the next step of an investigation. I'm reporting because I'm raising the flag for help. And if I don't know how to get the help and support, I'm raising the flag so that someone will partner with me to bring help and support to this family to keep them from being removed. I call that a little bit of reorganizing the pantry in practice. So many resources we have are made available to families on the opposite end once that investigation has taken place and that removal has happened. But those same services, those same supports clearly exist because we access them on the other side. It's about reorganizing the pantry so that when I raise the flag, when I'm accessing a decision tree and I'm making a decision about, did I capture low hanging fruit first? Did those efforts meet the need? If not, what else must we do to move forward? I can also include in that tier where I raise the flag and tap out for support from someone else. But it also means that we collectively, intentionally look at how we're training the workforce, because we can't make the ask for people to shift to mandated supporting without preparing and equipping them to do that work. And that is an investment that absolutely has to be a part of this frame.
Yes, absolutely. And when you think that for some families, almost everybody they see for, and maybe everybody that they see for help and support, medical people, educators, others, are mandated reporters. So everywhere you turned for help, you could get reported, right? And so this goes back to the distrust that lies in the system as a result of making everybody around you that you could possibly go to get some help a mandated reporter, and the need for the change in the mindset and the need for the change in the narrative, Dr. Hunter, that you've been talking about, Darnisha, also that you were referring to. I'm just reading something in the chat where somebody is saying that they came from a state where anyone over 18 is legally a mandated reporter. Stunning. Now, you guys are nodding. I am shocked. Anyone, no training, no, no decisions, no, just anyone. So if that isn't the, expansion of surveillance on poor families, Black and brown families, I mean, anyone, I just want to, obviously you can tell my reaction. I'd like to hear reaction from one of you all who may not be so, stunned by this as I am. What do you guys have to say about that? And what can a person do who may want to go to their state legislators or go to their, state departments and, make this case that this needs to change and that mandated supporting families, works. And really, what would you advise somebody in this situation? It's a tough one, isn't it?
Yeah, I'll just jump right in and be as brief as possible. I'm amazed at all the states being listed in the chat. I had no idea. And so I think it's upon us, and I'll start thinking, who are all the entities that need to know about the decision tree and other supports? We can't necessarily offer broad reflective supervision, but what are the entities that need to know about, for example, this type of a tool, a decision tree, to arm those general adults? I'm not being flippant here. I'm really, do we need to post something in every Walmart because people go to the grocery store, laundromats, airports in those states where people can see that they have something to help them make that decision. So it's food for thought for me and for the folks in those states. So thank you for sharing and increasing our awareness of that.
Yeah, thanks, Susan. What I'll add is that I think there are around 18 states that have universal mandated reporting laws, and in which everyone over 18 is a mandated reporter. I saw someone post in the chat that all homeowners are mandated reporters. I'm definitely going to look into that because it's so odd. I'm going to look into that to learn more about it. But I think that this really goes back to those levels of transformation that I lifted up, at the individual level, certainly in the decisions that you make, the processes that you put in place to help check yourself, to check your biases that can go either way, right? That can lead to over-reporting and under-reporting. At the organizational level, and Darnisha lifted up some of this so beautifully, it's about, and I think Susan did as well as Cynthia, it's about assessing your organizational policy, your practice, your training. What is the tone? What is the message that your staff are walking away with after completing your training, right? Do your organizational policies align with a shift towards supporting families? What are your organizational norms? Do you have processes for consultation or reflective supervision, as Susan lifted up? Do you have those partnerships with community-based organizations? And do your staff know how to connect families in need to these agencies? So that's at the organizational level. And then at the systems level, it's really about advocacy. It's about coalition building and it's about advocacy. And narrative change has to be a part of this, but narrative change has to be paired with an actionable and a viable path forward, a vision for transformation and for a new approach that's actually attainable.
That's wonderful. Thank you so much. Yes, we really have to think differently as a nation about this. And we have to engage each other in this raising awareness. I want to just ask each of our panelists to just give us a final thought here today. We don't have near enough time to talk about this topic. We could talk for at least another hour, but we are going to keep our time as we said it. But if each of you just take a quick, minute, just give me one final thought for our audience here who have been so moved by everything that you all have said here today.
I can jump in and give my fellow panelists a second to group their thoughts, because I wrote mine down because I wanted to make sure I said this. One thing to really think about as each of us in our own agencies advocate for our own programs, services, funding, etc., that mandated supporting cannot work if the other CBOs in our communities are underfunded, under-resourced, unavailable, understaffed. And so when we advocate for our own, we need to advocate for our community, because if there's no housing, if there's no income supports, no legal services, no mental health supports, who are we referring families to?
Yeah.
So advocate for yourself and the whole. So that's definitely, and I want to bring this to our national organization, the Child Care Aware of America group so that we can really touch the lives of individual child care providers. So thank you.
Thank you, Susan.
And
I would like to take it. Good, Cynthia, go ahead.
I'm just going to add to that, that if we want this to work, really work, funding does need to be supported for those warm handoffs when we are providing families with resources and referrals. It's not enough to just say, you know, here's a resource, here you go, and best of luck to you. There needs to be, you know, more done in that aspect.
Absolutely. Thank you, Cynthia. Final thoughts.
I'm
Yeah,
happy to go next.
oh, I'm sorry, Darnisha.
I was just
I'll
thinking
go
you were
after.
going to bring it home, Dr. Hunter, so I was going to go ahead and get it out there. You can go ahead.
Okay. What I'd love everyone to walk away with is just an awareness of the fact that the decision to report suspected child abuse and neglect or not report it is life-altering and should be treated as such. And as Dr. Maya Angelou so poignantly stated, when you know better, you have a responsibility to do better.
Amen. Yes, ma'am. Darnisha.
I was just going to share that true change happens when passion meets a plan. And all of us are really passionate about this. But if we want it to have the real impact, we absolutely need a plan. And it's at threefold. At the staff and agency level, it's about doing your own inventory, your own investigation, and your own bill, because policy will come and we won't be ready for it. At the community level, it's about your coalition building and joining hands with someone else who has access that you don't have for greater reach and connectedness in how we work together. And at the state level, it's about closing the loop with advocacy to support funding and increasing access where we have known barriers. But none of us are responsible for doing this on our own.
Thank you so much for that. Yes, it all takes the collective action, correct? Well, we appreciate you so much, every single one of you. Thank you, thank you, thank you. We appreciate our audience, again, for being so interactive with us and giving us food for thought as well in the chat, in the Q&A. We want to ask our audience to remember to fill out our survey. And we want to remind you that the materials from this webinar will be coming to you and available to you. I just really, I have sort of I want to make a promise I probably can't make, but I would really like to continue this conversation, and we're going to find a way to continue this conversation. It's critical, and you know, people, when you talk about mandated reporting, people feel like it's just a hopeless situation, and there's nothing we can do about it. But there is, obviously, clearly. So thank you for doing that work. Thank you for being with us today, and we will see everybody next time.